Hi, I am Dr. Jean-Pierre Kabongo, health advocate, founder of the Homestead Education Movement, the Glycemic Index and Homestead Education Restoring Health One Meal at a Time. Today, we will continue talking about the glycemic index, not as a diet trend, but as a powerful clinical tool. The glycemic index helps us understand how different foods affect blood sugar, insulin levels, and inflammation in the body. And when you look closely, you begin to see something remarkable. Many of today's most common conditions, diabetes, obesity, PCOS, cardiovascular disease, fatty liver disease, even mood and cognitive disorders, share a common metabolic root: unstable blood sugar. In this video, I'll walk you through the major diseases and conditions where glycemic index principles are supported by evidence and used in real clinical practice. I'll also share a real patient story, a young woman with polycystic ovary syndrome, to show how simple, targeted dietary changes can restore hormonal balance, fertility, and hope. Within the Homestead Education approach, nutrition is not about restriction. It's about restoration. Because when we choose foods that stabilize blood sugar and lower insulin demand, we give the body the conditions it needs to heal itself. Diseases and conditions using glycemic index principles. The glycemic index (GI) is a useful dietary tool in several metabolic, endocrine, cardiovascular, and neurological conditions, because it helps reduce post-meal glucose spikes, insulin demand, and inflammation. Below is a clinically oriented list of diseases and conditions where GI principles are commonly used or supported by evidence. 1. Diabetes mellitus. Type 1 diabetes helps predict postprandial glucose excursions, improve insulin timing and dosing, especially useful with carbohydrate counting plus insulin to carb ratios. 2. Type 2 diabetes. Strongest evidence base: benefits: improved HbA1c, reduced post-meal hyperglycemia, improved insulin sensitivity. Low GI diets are endorsed by Diabetes Canada, ADA, American Diabetes Association. 3. Prediabetes and insulin resistance. Slows progression to type 2 diabetes, reduces fasting glucose, post-meal insulin spikes, works synergistically with weight loss, physical activity. 4. Obesity and metabolic syndrome. Low GI foods improve satiety, reduce hunger and caloric intake, lower insulin-driven fat storage, metabolic syndrome components improved, waist circumference, triglycerides, HDL cholesterol, blood pressure. 5. Cardiovascular disease, CVD. Lower GI diets associated with reduced LDL cholesterol, lower triglycerides, reduced inflammatory markers, CRP. High GI diets linked to increased risk of coronary artery disease, stroke. 6. Polycystic ovary syndrome, PCOS, a common hormonal disorder in women of reproductive age, characterized by irregular ovulation, elevated male hormone levels, and insulin resistance, often presenting with menstrual irregularities, acne or excess hair growth and weight gain. Key benefits: improves insulin resistance, core driver of PCOS, may help regulate ovulation, androgen levels, often combined with weight management, exercise. Metformin. Sharon, 27 years old, female patient of mine, is a professional chef. She had been married for 4 years, has been looking for a baby for 2 years. She had been having irregular periods, sometimes skipping 3 to 4 months. Physical examination revealed elevated body weight with a BMI of 31, some facial hair, and acne. Her blood test and ultrasound confirmed the diagnosis of polycystic ovary syndrome. I reviewed her diet, mostly refined carbohydrates. She was drinking soda 2 to 3 times a day, had no regular physical exercise. I referred her to a specialist gynecologist. In the meantime, I advised her to change her diet, replacing rice by quinoa, her potatoes by sweet potatoes, increase vegetables and nuts, cut on all sugary beverages, and remove dessert. She was advised to drink water rather than soda. I advised her to have 30-minute brisk walk every second day and started her on magnesium glucinate 200 milligrams twice a day. I put her on metformin 500 milligrams daily. Given that she was so desperate to have a child, especially with all the bad mouthing that was going on with her in-laws, she scrupulously followed my recommendations. After 6 weeks, she had lost 9 pounds. 2 months later, she has lost 15 pounds. On the 4th month, her period returned to her normal rhythm. By the time the gynecologist contacted her 5 months later, she was currently pregnant. All of these are application of the glycemic index principle. 6. Non-alcoholic fatty liver disease, NAFLD, MASLD. Low GI diets. Reduce hepatic fat accumulation. Lower insulin and de novo lipogenesis. Important adjunct to calorie control. Weight loss. 7. Reactive postprandial hypoglycemia. A condition in which blood glucose drops abnormally low within about 2-4 hours after eating, usually due to an exaggerated insulin response to a meal, often high in refined carbohydrates. Low GI meals. Reduce rapid glucose spikes, prevent excessive insulin release. Often combined with smaller frequent meals, balanced macronutrients, protein, fat. 8. Gestational diabetes mellitus GDM. Low GI diets. Improve glycemic control. Reduce need for insulin. Lower risk of fetal macrosomia, commonly used in prenatal nutrition counseling. 9. Epilepsy, adjunctive role. Low GI treatment LGIT, a modified ketogenic approach used in drug-resistant epilepsy. Less restrictive than classic ketogenic diets. More sustainable for some patients. 10. Cognitive and neurological conditions, emerging evidence. Conditions under study. Mild cognitive impairment. Alzheimer's disease, type 3 diabetes hypothesis. Rationale. Reduced glucose variability. Improved cerebral insulin signaling. Evidence still evolving. 11. Mood disorders, adjunctive role. Depression and anxiety, indirect benefit. Stable blood glucose helps reduce fatigue and irritability. Improve energy regulation, fits within nutritional psychiatry frameworks. 12. Acne and some inflammatory skin conditions. High GI diets associated with increased acne severity. Low GI diets may reduce insulin-like growth factor 1, IGF-1, sebum production. Itch. Conclusion. Glycemic index and the homesteadication principle. The glycemic index reminds us of a powerful truth. Food directly shapes our biology. Within the homesteadication framework, nutrition comes first, not as restriction but as restoration. By choosing foods that stabilize blood sugar, reduce insulin demand, and support metabolic healing, we allow the body to do what it was designed to do, recover. Glycemic index is not a diet. It is a lens, a way of understanding how food acts as medicine. When applied thoughtfully, it supports the reversal of type 2 diabetes, sustainable weight loss, and long-term metabolic health. Choosing foods with a lower glycemic index means giving your pancreas a break. If you know of someone struggling with prediabetes, or diabetes, excess weight, PCOS, fatty liver, or someone just willing to maintain their weight and energy naturally, please send them this video. Please comment and like this video to increase its visibility, hoping that it can save lives. Also, please tell me from which country you are watching this video from. Thank you for watching.